This video is the product of the Functional Cranial Release Research Institute. For difficult neurologic conditions that no one seems to have answers for, visit functionalcranialrelease.com.
This is you before. Okay, look at the tip of my nose. See your eye like moves away? Tip of my nose. See your eyes aren't looking at the same spot? See how they kind of shift like that?
That was really bad.
Okay, so look at the tip of my nose.
Randomly, I had double vision about a year ago, and I got really sick. I had to come home from school. Couldn't even sit in class anymore. I had to leave. It was like the weirdest thing, and I don't know why. It just randomly came on. And I went to like so many doctors, neuro-ophthalmologist, a pen, and then like a regular doctor and other doctors too. And they just told me that I was tired, which is, I mean, it's not their fault, like, they don't know, but I knew, like, it wasn't because I was tired, because I've been tired before and I could see, so, thinking that maybe I would just get better, and it never happened, so.
So what's been your experience with the eye exercises as well as the functional cranial release as far as your results?
I see, like, such a big improvement, like, really dramatic. Even in the last month, I can pay attention in class, I can read again, and like little things, you know, that we take for granted and become a lot simpler. So it's been a dramatic improvement.
My vision just started to get a little weird, and I had never felt sensations like that before, so I couldn't really explain it. And then there was this pain on this bone right here that was just, oh, I would just like stay awake and cry from it. It was terrible. It was like blinding, the sharpest ever. And I had no idea why, and neither did they. Obviously less pressure. I think that was the big difference. As soon as we did the first one, the first inflation, it felt like just something just let go. And instead of being like clenched, things were open. I could feel like a difference in my nose. The first night, instead of being stuffy, I could just kind of breathe. No one else looked into anything with this. It's just, this is what you have. They said misaligned eye, and the pain, they just didn't know, and they didn't care to delve into that at all. It was just get used to it, I guess. Neurologists, ophthalmologists, neuro-ophthalmologists, people with Reiki, someone who does some kind of Eastern philosophy. I think it's Tom Wren. Just everyone you could possibly think of, I've tried, because I just have this drive to get back to where I was before, I guess, that won't let me stop.
And you traveled here from
Boston.
Even
if somehow my double vision doesn't go away, no one's like looked into it as much as this, or cared as much to try and help me. So
everything could be explained. I mean, they didn't know I had double vision. I mean, it probably doesn't happen to a lot of people, but the people that it does, they need answers. So that's important.
Hi, this is Dr. John. Thanks for joining me. If you or a loved one suffers from difficult neurologic conditions that no one seems to have answers for, send them to functionalcranialrelease.com. You can contact me by phone or email me at askdrjl@gmail.com. And remember, if healing is possible, consider it to be within your reach. Bye for now.
functionalcranialrelease.com